Present your case. My patient Farida Parveen, a 6-month-old girl healing from Bogora, presented to me with the complaints of absence of anal opening since birth, passage of stool through an abnormal opening near the vaginal opening, a small opening in midline at lower part of the back. According to the statement of informant mother, presenting complaint started since birth. The baby was born without an anal opening and passed stool through an abnormal opening near the vagina. Initially, the baby passed stool without difficulty, but for the last 2 months, there is occasional difficulty during passage of hard stool. There is occasional development of abdominal distension, which is not associated with vomiting and is relieved after passage of large amount of stool. She passes urine normally. The mother also complains of a small opening at the midline of the lower part of the back with no history of discharge through it. There is no history of abnormal development or abnormal movement of the lower limbs. For these complaints, they attended a doctor after birth, but she was advised to come for 6 months. After 6 months, patient lives on breast milk and occasional formula feed. Patient is immunized according to EPI schedule. The child weight is 6 kg. She is non-anemic, non-icteric, non-dehydrated or edematous. Pulse, BP, temperature, respiratory rate are normal. Anal opening is absent. There is skin tag, dimple at the site of normal anal opening. Buttock is well developed. There are 3 openings in the vestibule, one urethral opening, one vaginal opening, and another small opening put just below the vaginal opening, which is fecal stained. Excoriation is present in the inner aspect of the labia majora. There is a sinus at the mid-sacrum through which no discharge comes out. There is a bony gap beneath the sinus. Abdomen is normal in shape. Umbilicus is normally placed and there is no visible peristalsis. Hernial orifices are intact. There is no organomegaly, no fecaloma or any palpable lump in the lower abdomen. Motor activity and muscle bulk of both lower limbs are normal. Examination of other system reveals no abnormality. So, from history and clinical examination, my provisional diagnosis is vestibular anus with spina bifida occulta. DD, anorectal malformation with rectovestibular fistula.